The following are 5 common misconceptions about suicide. People who talk about suicide won't really do it. Not true. Almost everyone who commits or attempts suicide has given some clue or warning. Do not ignore suicide threats. Statements like, "You'll be sorry when I'm dead," "I can't see any way out," no matter how casually or jokingly said, may indicate serious suicidal feelings. Anyone who tries to kill him or herself must be crazy. Not true. Most suicidal people are not psychotic or insane. They may be upset, grief-stricken, depressed, or despairing. Extreme distress and emotional pain are signs of mental illness, but are not signs of psychosis. If a person is determined to kill him or herself, nothing is going to stop him or her. Not true. Even the most severely depressed person has mixed feelings about death, and most waver until the very last moment between wanting to live and wanting to end their pain. Most suicidal people do not want to die. They want the pain to stop. The impulse to end it all, however overpowering, does not last forever. People who commit suicide are people who are unwilling to seek help. Not true. Studies of adult suicide victims have shown that more than half had sought medical help within 6 months before their deaths, and a majority had seen a medical professional within 1 month of their death. Talking about suicide may give someone the idea. Not true. You don't give a suicidal person ideas by talking about suicide. The opposite is true. Bringing up the subject of suicide and discussing it openly is one of the most helpful things you can do. Remember, suicide and suicidal thoughts are not to be taken lightly. If you or anyone you know are struggling with emotional distress and are contemplating hurting yourself, you can always call the Suicide Prevention Lifeline at 1-800-273-TALK 8255.